guys, welcome to the Q Effect. I am Laquan James, your gentle giant, where we specialize in everything natural when it comes to beauty. We want you to look good from the inside and out. That is our motto, because if you look bad on the inside, it's probably going to be on the outside as well. But we do that with cutting edge technology like regenerative medicine, peptides, hormone therapy, skincare. We're pretty much a one-stop shop. But today we're going to be talking about a lot of different things regards to health, of how you can be great always. But today we have a special guest, a good friend of mine, Mr. Antonio Jackson.
Yes.
One thing I learned about him as I was, taking care of him, he was a patient first, was that he's a vet. And for me, I don't know a lot of Black veterinarians. So instantly I wanted to know about him, more about him. How did he become as great as he is, and everything that there is struggles as far as benefits, risks, everything that goes with being a veterinarian.
Right.
But here in Atlanta, he started from the ground up. He has a clinic called, what is it called?
Soft Paws Animal Clinic and Urgent
Soft
Care.
Paws Animal Clinic and Emergency. So we're going to be getting to know him, just to know more about animals, his career, what he's doing in the future, and just pretty much anything you would want to know, because at the end of the day, this is a podcast for you to learn all the things that you don't know, how to take care of your animals, and so forth and so forth. So we're going to get to know him, and we're going to give you some good information.
Yeah, I'm appreciative as well. So I just this is the first time someone's actually paid attention to what I do or my journey, any of that. So the fact that you asked me to come on the podcast was like, that's crazy. Yeah,
absolutely.
Yeah, I was also interested in doing a documentary of my whole journey to get to where I am. So yeah, I definitely appreciate being here.
Because as we know, being African American, it is much harder for us. And being a man, it is much harder to do these types of fields, and especially work in your own field, have your own business. Right. There's a lot that we don't learn as providers, and that's the business side.
Yes.
Right.
Yes.
So we have made our mistakes, but here we are today. And so I'm glad you're here to be on our podcast.
Cool.
Okay. So tell me, what made you go into, taking care of animals?
Veterinary medicine?
Yeah.
I kind of feel like this is cliche, but I feel like I really truly came out of the womb like this. I'm from a place called Mansfield, Louisiana, small town, country town, raised around animals, pretty much rodeoed as a kid. So honestly, I thought everyone on earth rodeo. I thought they did what I did. Mm-hmm. So I was just one of those kids that got into the field of animals early, and I just never strayed away from it. I always knew what I wanted, and every day I woke up, I did something to try to reach that goal.
That's awesome. Mm-hmm. And guys, quick little break here is we actually met because, a lot of times as providers, we are so busy taking care of everyone else.
Oh yeah.
That we forget about ourselves.
Yes.
And so how we met was, one of his assistants told him about what I do, and we're actually down the street from each other. And, he's wanting to take better care of himself. So that's how we met. He booked an appointment. Well, of course, for me, it's not just an appointment. I like to get to know my patients when they come in. And then next thing you know, we became friends, and I want to know more about him. So he came in, we tested his blood work, got him on some peptides.
Right.
You see those arms? So, he has definitely, been taking good care of himself, and it went further into what we expected.
Yeah.
Our appointment ended up being over an hour on the first day we met.
And it's just talking about health, mental health, wellness, taking care of your mental, your body, all of that. And when you're working as an entrepreneur, sometimes you're so focused, you're really not, you don't have a healthy lifestyle.
Correct.
Your diet may not be healthy, etc. So me knowing that, I wanted to fix it. So that's how we ended up here.
And that's exactly why I have a one-stop shop.
Yeah.
Because I'm so busy, I don't have time to go with Atlanta traffic.
Yeah.
I don't have time to work all day, then go see the massage therapist here, the chiropractor here. So because they're in the office, I can actually get it done.
Which is why I got my facial here as well.
Exactly. So that inspired the one-stop shop scenario for me as well. Okay. So where did you get your passion from animals?
The honest answer, I have to say God, because I don't know why I'm like this, but I have always been like this. I have an uncle, his name is Dale Ross. And I used to ride on the back of a truck, go and treat cattle, bottle feed, little calves that can't necessarily have their moms to grow up with. So it's just something I kind of leaned on. I wasn't a video game kid. I was outdoor kid. My mom wouldn't really let me have animals, so I started feeding stray cats. So, you see this little boy walking up the street, and 10 cats following him. At some point, you're going to realize that, oh, he's feeding the cats. So it's just something I kind of gravitated to, and I just never went away from it, and I don't feel like I work a day in my life.
And that's what a true career is something that you can wake up any time of day and do it. Because people ask me, come on, like, I don't know how you do it. You travel all over the place. I want my influence to be everywhere.
Yeah. And, seeing a pet ill or sick, and then because initially we didn't have the money to take a pet to the vet or any of that. So all we could do is more like nursing care, try to give them water or put food in their mouths. And all of a sudden they actually get better. I think seeing them improve kind of stuck with me. I was like, wow, I can actually, help. I can fix them. And it kind of stuck with me as a kid. I mean, I'm talking like 4 to 7 years old. Those were the years it really was ingrained in me. Yeah. My mom and dad hated animals, by the way. They were, and now it's crazy because my dad has cattle and goat, and my mom has a dog that kind of roams the yard. But when I was little, it wasn't my mom and dad that instilled the animals in me. It was my uncle, Dale. That's who I worked with, go make a little extra money as a kid. Yeah.
When you were in school, was there any point where you doubted yourself?
I've never doubted myself. If anything, I count on myself. I know my capabilities, which is really just, I was a different kid. I would wake up, I had a little, I was always in business too. So I would have like candy and
I did that too.
Debbie cakes. Yeah.
Yeah.
And I would sell them. I would do inventory in the morning, inventory at night. I don't know where my mom is business oriented. She's been doing tax preparation pretty much all her life. Me and my brother used to fight because he used to go in my candy and my cakes, and I would notice something's out of my inventory missing, and I investigate and figure out who it is. So the business mind, it just came naturally, honestly. I have no coaching. I didn't really have a mentor in business. So like you said, you make a lot of mistakes and you figure it out. And I think making those mistakes were helpful because now I know the different things that had I hired somebody, I probably wouldn't know.
Yeah.
Yeah.
And that's one thing I learned through business too, was the mistakes, but also now I teach it to other healthcare providers that want to venture out on their own. When I tell them, look, I promise you, I made every mistake that you can make, and I'm here to teach you that too, because I could teach you how to do Botox and filler all day, but if I don't teach you how to save money, how to manage things, how to hire the right people, then it doesn't matter what I teach you. Like you have to learn how to open your door and keep the lights on.
Yeah, and for me, I didn't have the budget to hire the right people, so I had to get who I could get with what I could afford and just make it work. When you first open a business, and a lot of people don't realize, they think veterinarians just play with puppies all day. But no, there are pets that, we have to make a decision to let them go, and that can be heavy if you do a couple of those a day. There are some clients whose pet genuinely are their kids because they may not be able to have kids.
Correct.
There are surgeries, crazy. We do pretty much everything a human doctor would do. The difference is human doctors normally focus on one specialty. One moment I may be pulling teeth. The next moment I may be taking out a spleen, amputating a leg. We never know what's going to show up. And when emergencies come in, it's a real deal emergency sometimes.
Yeah.
And some people that when you say veterinarian, they just think, oh, vaccines, they play with puppies, but it's a completely different realm of medicine that people just aren't aware of.
Correct.
Yeah.
And that's why I wanted you on here, because lack of education. You don't see anything, commercials on TV or anything like that explains exactly what you do.
Yeah.
I mean, growing up where I'm from, you know, as I've had my own puppy as an adult, well, I never knew that growing up, I never knew that they're supposed to get vaccines and all these other things. So the few dogs that we had failed because now as an adult, I know, oh, we were supposed to be doing this, that, and the third, and we wasn't doing that.
Yes.
So now I know what to do.
And most of it's preventable.
Yeah.
Like 90% of the things pets pass away from in households that don't necessarily take their pet to the vet, a lot of it's preventable. Yep.
So what was your first job?
I loved my first job. Had I not had an issue with one of the employees, I probably would still be doing it. I worked at, it's called Southern Classic in Louisiana. For y'all that know, Southern Classic is the way to go. It's a fried chicken place. Addictive. It's like they put crack in the chicken, I swear. But I was there, man, and I just cooked chicken every day. I cook chicken. I like serving people, you know, making them. I love food. In Louisiana, we cook a lot. And I did that in high school, and I loved it. I loved it. I still talk about that to this day. Absolutely. I would go back. I would go do it just for fun.
So you know what my first job was?
What was it?
You know, Wendy's, right?
Yeah.
Me and my brother, twin brother. I have a twin brother. And we had so many people coming to Wendy's because we were making up so many different sandwiches.
Yeah,
the Baconator, me and my brother Ben did that. We was like, oh man, we should have patented that.
That's my go-to, the
Yes.
Baconator. But you know you wasn't supposed to do that, right?
No.
Yeah.
Me and my brother, because I mean, they never noticed, but they would get more business because of me and my brother.
Yeah.
And then people was like, oh, is Quan and Sean working?
Yeah.
Because we was making up all kinds of sandwiches back there, but it was really
Yeah, that was, I can imagine, because that Baconator, it hits.
Oh, it's off the chain.
It hits.
Yeah, I won't eat that
have it
now,
now.
though. I
Like,
care about my physique now.
Right.
And then what was your first job as a vet when you got out of school?
So I worked as a veterinary technician. My journey was very unique. Vet school was not difficult for me at all. If you didn't know, veterinary medicine, vets, has one of the highest suicide rates in a profession of medicine. I worked as a technician before I went to vet school, but I also worked as a technician while I was in vet. I worked almost a full-time job while I was in school, which was unheard of.
Yeah.
That typically you don't do that. When I graduated, I did work at a hospital in Houston. They got some experience with Animal Planet. And they opened my eyes to how good I was as a first-year grad. I was doing surgeries that you normally didn't do until year 4 to 6. But I would come out, I'm comfortable. I think I freaked my boss out one day because I had to do a surgery on his dog. And I mean, it was just easy for me. I will say I prepared myself well. So when I graduated, I was ready to go to work. I didn't need necessarily
A residency?
no vet need a residency. If you feel comfortable performing the skill, you can just do whatever you want. You don't necessarily have to do a residency. That's the difference between human medicine. But when I graduated, I was so comfortable at what I did, it made my bosses uncomfortable. Because typically, if you're a first-year grad, you need mentorship, hands-on teaching. And I wasn't asking many questions. If they asked me something, I knew the answer. They just weren't used to that, and that's what kind of opened my eyes. Like, what's wrong? Is this weird or abnormal, or am I doing something wrong? That's like, no, you don't have any questions, and it's kind of awkward, for a first year grad. So I started paying attention, and that's what kind of opened my eyes to like, wow, I think I may be kind of decent at doing this, And then another situation was on a Saturday I worked by myself. So that Monday came around and they sat me down. I was like, oh, what I've done something wrong. I was like, we just trying to understand how you did this. You did surgery. You did all the C-sections. Everybody still got out on time. The employees went home on time. And they was asking me, and I genuinely did not know. I was like, I was just working, so I don't know what to tell you. So, I mean, the best they could have done maybe is went back to look at the camera, but I didn't have an explanation for why I did what I did. It was just kind of natural for me. I didn't realize I was doing something special.
I mean, it'd be like that sometimes, but also too, I know for me, I have the burden of wanting to be great. And then also specifically in my field, especially what I do, is predominantly ran by white or female people. So you want to be great.
Yeah.
Like a lot of people that come here and train under me, they're like, how are you doing all these? Like, I can do 10 different procedures in one day on several different patients.
Yeah.
And they're just like, how do you just remember all of these steps?
Yeah.
So it's kind of the same way.
I feel that too, because it's the same in veterinary medicine. Some people, I have students that I mentor, veterinary students that will come, and it's really easy. It's not that difficult to multitask. And
Correct.
the issue is you've not practiced. So a lot of people they're just not comfortable with it. But I can probably do a million things at one time and be perfectly fine.
And that's what I also tell people going into school, because I know when I was in nursing school, I worked in the ER as well. So school was just boring to me.
Yeah.
Because, when we took tests and stuff, I would answer the questions as if I'm in the ER.
Yeah.
But textbook wise, it's different. But when you're in the field,
It's
so it was definitely a learning curve. They want to give you the white answer and not, the gray answer.
Yeah.
So I think that people, if they want to be in medicine, I feel like they should shadow or work a work or something to actually see how it works.
Right.
Because you made it through school, but sometimes the textbook way is not the way for you to get the result.
I'm gonna say this. I don't think everybody is built for medicine, like in a hospital, because their stress level, their anxiety, sometimes it's so high it becomes unhealthy for them. I see people all the time that's trying to be in the clinic, and they love ER, they're trying to do ER medicine, but they're just not taking care of themselves to a point to where they can handle the caseload.
Correct.
Or the anxiety or the stress. Because if an emergency comes in, you don't have 5 minutes to figure. You have to make a decision.
Exactly.
And you have to be able to stand on the decision you make. And even in making a decision, some people they stress themselves out about, okay, did I make the right decision, the wrong decision? But ultimately, I've seen it a lot, which is why in veterinary medicine, sometimes the workload, the schedules, humane euthanasia, that's why the suicide rate is so high. Not on top of that, you have clients that come in and they're bullies to the veterinarians. Oh, I don't really have, the money to pay for it, but you should still fix the pet, which we are as compassionate, as we can be. But ultimately, we have bills to pay as well, So if clients come and they can't afford care, they kind of bully us to try to make us do the job for free, if that makes sense. And it's definitely an awareness thing, because I don't tolerate the belittling, rudeness, any of that. I just don't service the client.
Yeah, you have to. And that's one thing that people don't realize is you have the right to do that.
Yeah.
You can say no.
Yes.
Because half of those people that's never been told no, whether you got one today.
Yes.
So go and think about it.
And most of them have gone to corporate entities that believe that the customer is always right, which, I understand that, but to some degree, the customer has to have some type of decorum and respect for the people that they're asking help from.
Correct.
And if they don't have that, then I just don't service them.
We definitely alike on that.
Yeah.
For sure. So as you was working, when did you decide that, okay, I want to do my own thing. I want to start my own clinic?
I feel like that was always the goal.
Yeah.
The move. A lot of places I went to work for, the way that, because we're not taught as veterinarians to do business. So a lot of the places I worked for, the management wasn't great. The business operations just wasn't great. So I struggled as a up and coming entrepreneur. I've been learning business since I was a little boy. I struggled with the operations, the medicine and things like that across the board. You know, we're doctors, so we'll take care of that.
Yeah.
But it's mostly the management and everything. So the goal has always been to open my own hospital. But of course, I'm Black. When I go try to get funding, it becomes an issue. So
1 second.
it's
We're gonna pick up from there.
Okay.
Because being Black, the difficulty.
Gotcha.
Yeah, she's heading out.
Okay.
Okay. Have a good day.
I want to get a procedure done right now. I know that.
Yeah.
Yeah, she wanted that.
Oh, she want her blood work done.
Yeah. So, pick up from. I wanted to open a clinic. Of course, I'm Black.
Gotcha.
Go from there. Ready? 3, 2, 1, and action.
Yeah, the goal was always to open my own hospital, but of course, being Black has its challenges. I did the first bank. I won't call any names, but went to my first bank, gave them my business plan. I mean, it was laid out. They're like, man, this is a great business plan, but we've just never seen it done before. So of course, they didn't give me funding. They had to find a reason, as I say, to deny me. So what I did was I went into my savings. I went and bought a cargo trailer, the trailer that you pull race cars around with, and I converted it into a mobile vet unit because I already had a truck. So I just pulled it behind my truck that first year after. I mean, I did the plumbing, the electrical. I put cages. I did everything. And that first year, I think I made 350 to 400K. And then, of course, the banks are calling then. But the goal was always to open a practice. I never knew what that looked like. I just took at least one step every day to try to reach that goal. And I guess it worked.
Yeah.
Yeah.
I've been through that too. Like when I was getting ready to buy my office space, I mean, they basically try to play you like you ain't got it. Man, you think I'm going to walk in here if I ain't got it? Like, what?
They do. And I mean, they look for reasons to deny you.
Yeah.
Well, you need this. I mean, I just gave it to you. It's right in front of you. Yeah, they do that.
It's crazy. And the way they do it, it discourages you some because you're just like, if I was white, this would not be the case.
Yeah.
But you want to call me out on all these things, and all of this shows that it could be paid for.
Yeah, yeah.
It's.
And you know, when I went to the bank, I mean, honestly, coming up probably until maybe 8 years ago, I felt like I was just hustling. I had this doctorate degree, but I still felt like I was just hustling, trying to get ahead, and I always need some type of help. You know, my family had the wisdom, the knowledge. They taught me skill. They taught me all of that, which is rich in substance as a person, but financially, we just didn't have it. They didn't have the money to just give me to open a practice. So I needed the help. So I would go to the bank, try different grants and stuff like that, and it just wasn't liquidating to where I can actually use it. So, you know, I went from a table, tent, and a cooler, because that's how I started my mobile practice, until I had like 60 people in line. I was like, okay, we got to do something different. Then I built the cargo trailer, and I would pull that behind my truck, and it just kind of kept going. I moved here, my clients, certain things on a mobile platform, because I was a mobile veterinarian, you just can't do. So I would have to refer my clients to the ER and the different surgeons, and they hated it. So they kind of rallied together. It's like, hey, we don't want to go anywhere else. So if you don't do it, it just won't get done. So they kind of forced me to open a brick and mortar, which I opened a smaller location. Now I'm out of space, because now we get referrals from different hospitals that don't have the space. So we get their clients back to them, but we may see them once or twice. So it's turned into something I didn't even imagine, honestly.
And that's what happens with the hustle, because you look back later, even when I walk into my office, to go from something that's 1,200 square feet to pretty much 7,000 square feet, and it's yours.
Yep.
You know, and starting on my own, I was a little nervous, but not nervous to the point, because, you know, I was working somewhere that's like 45 minutes from here.
Yeah.
My patients wasn't driving out there.
Yeah.
So I pretty much started in the Atlanta area with 0 patients, and it grew from 0 to over 4,000 in that, 4 years. So you look back and you're like, dang, it was the hustle, but it's also those patients that you have. Well, they care about you as a person.
Yeah.
And they don't want anybody else to touch
Exactly.
them.
Exactly.
And that's how it is for what I do.
Yeah.
They don't want to go. They'd rather wait
Yep.
than go to someone else.
Yep. And what it
Yeah.
does is, as a practitioner for me, if it's a surgery I've not done, they teach us in school to go read a book, go review your anatomy, your physiology, all of that. And you technically should be able to perform the surgery
Exactly.
if you've not done it before.
Exactly.
That's why it's called practicing medicine.
Correct.
The issue is a lot of people get so comfortable to where they don't step outside of their comfort zone. So when I have those clients that won't go anywhere else but the patient needs care, I have to figure it out. I don't really have a choice. Not only that, but an ER compared to me, price-wise, is some people, I can't probably afford some of the things at the ER. It's just that expensive.
Listen, taking care of animals is costly.
It is. It's expensive.
Even more than children.
Which is why I added on the urgent care, and we stay open a little bit later, because for an ear infection, you go to ER, you're gonna pay $600 just for an ear infection. But if you can go to urgent care, of course you get a better price in there.
Correct.
Yeah.
Correct. So y'all hear that?
Yeah.
Go to his urgent care, not the ER.
Yeah.
The cost is way different.
100%. 100%. And we also work with the client's budgets. The craziest things is every practitioner is different, right? So you go, they may give you a quote. Well, that's the quote that they want you to have. But we work with whatever the client has. If they have $50, then great. We're going to do what we can do with $50. If they have $200, well, if you go to some places and you just don't have it, you just don't get anything done, which I don't, we just try to find help for the client.
Yeah.
Yeah. It's more family oriented,
And most places won't do that. They just send you out the door.
which ultimately leaves the patient untreated, which is not the goal. It's not the goal at all.
Yeah.
So it's been a unique thing, it's been very rewarding. When I first started, man, I was working all day long, but I love what I do. But it still wasn't healthy for me, right? So when I moved here, I had to move my business from Nashville to here, get established. So, I mean, I was so focused to where I wasn't buying shoes, I wasn't buying scrubs, I wasn't eating out, I wasn't getting massage, I wasn't doing anything for myself just to make sure the business got built. Because if I didn't do it, it just wasn't going to get done. I couldn't depend on going to a bank, getting denied again. So ultimately, it was stressful. It would have been more stressful to, maybe other individuals that don't necessarily enjoy what they do. But it took a lot of sacrifice. I missed a lot of my nieces, nephews' birthdays, just family events that people don't understand. They look at you and it's like, oh, he looked nice, he got this, he got that. They don't understand what it cost me to get there. So now I'm less likely to miss anything. And
that's common with a lot of things. Like, even I have quite a few friends that are actors. I mean, what they have to do, like, you gotta stay ready.
Yeah.
Like, you could be doing a side hustle and they're like, hey, we need you now.
Yep.
You got to drop that and go,
irrespective of what you got planned.
Yeah. And even in our field, like, even, like, people judge me for being on steroids all the time. If y'all used to see I was 330 pounds and me doing cardio 45 minutes a day, eating under 2,000 calories,
And
then you would have
nothing's working.
Correct.
Yep.
And then you have a different perspective.
Yeah.
But because you wasn't there to see it, you just don't hear typing your fingers on Instagram and ain't see nothing.
Yep.
But half of them got to pop the piss in anyway. So it's a lot of people will judge, but they have no idea the blood, sweat, and tears, 3 hours of sleep, you working all the time to get where you are today.
Yeah. It's crazy, man.
Yeah.
Gladly, I'm not a person that I'm not affected by other people's thoughts or their opinions.
Exactly. Life's too short to care.
Yeah, it don't bother me at all. Because they don't really pay my bills.
Exactly.
They're not helping me. They don't see what it takes to get to where I am. So, and honestly, a lot of people probably couldn't do what I do, so, I mean, they feel how they feel. it is what it is.
Sometimes when I got time, I let them know.
Yeah, I am a little bit more, and to be real with you, this has come up, so I think we should address it. I actually used to have like anger issues, right? But when I was in undergrad, I was like, okay, I'm gonna be a professional. I can't really pop off on people like that. So I started working on that in vet school. So when I was in vet school, if it was a client, if it was one of my classmates, if it was my professor, I used that to try to make myself be more professional and less triggered, etc. So when someone says something like that, I can address it and not so much
Nice,
of a,
nasty.
Yeah, I can be a real.
I am superb at that now.
Yeah.
They don't even know I did it. But
Right,
I did.
right, yeah, yeah. And you're very outspoken, so they'll back up.
Yeah.
Yeah.
For you, so what was your proudest moment as a vet doc? It could have been just you starting on your own.
Bro, that is an emotional question.
Yeah.
And we just
know I was
started.
gonna
We
get there.
just started the podcast. If I can be real with you, I literally maybe the last 8 months sat down and realized what I've done. I have not. I didn't realize. Everybody else would like my mom would be like, "Hey, you should do something for yourself for." Like for what? I'm just going to work. I didn't realize it. My friends would tell me, everybody would praise me for what I've done. But when I'm sitting in silence now, and I was like, wow, that was kind of crazy. I don't even know how I did that. And they would ask me, how do you do this? How did you get this done? I genuinely don't know. I'm just working, and I love it. If I had to work a 12-hour shift, I will say that being a technician helped, because I was at an ER. I worked 12-hour shifts 4 to 5 times a week. So my body, my mind got used to it. So as a doctor, if I had to work a 12, 14-hour shift, I'm cool with it. Most people that go to vet school, some of them haven't been in a clinic for 10 hours in one day. So when you graduate and you have these rigorous schedules and you learning new techniques and you trying to learn how to be a doctor, that can be stressful.
Oh yeah.
So I don't think I think I recently realized what I have done, and I've started, which is why I come see you, because I was like, I need to take some time to love on myself, because I'm always taking care of everybody else, trying to make sure my family's great, to the point to where I start abandoning myself,
Correct.
So it's something that's why I say it's emotional, because sometimes I was like, I don't know how I got to this point. I always knew that if anything happened to my mom, my dad, I wanted to be the one to be able to take care of them.
Same.
I will say that when I was little, I was raised by elders. Gladly, all of those elders are still here. So for my birthday, I had a big party and I brought my whole family up, but we haven't lost anybody yet. And they taught me everything. I'm a combination of everybody in my family. They kind of pitch in different things.
Yeah.
So yeah, I'm realizing now what people see, wow, the wow factor in what I've done based off of where I come from. But yeah, I didn't see it before.
And that's what I told you when we met.
Yeah.
The people that know you will tell you your worth, even though you don't see it sometimes.
Yeah. Yeah, I really didn't.
So everybody has, a tough case, like as well as a patient that can take a toll on you emotionally and physically. Did you ever have one of those?
Yeah, it's the ones where, I get a lot of cases where a dog is the only thing that they have left. I've had multiple clients come in on the verge of suicide, and if I didn't save that dog, I didn't know if they was actually going to pull the trigger or not. So although it's not my responsibility, it was a pressure that was undeniable. So, those cases, seeing them come in, the owners trust me, and the dog walk out and go back home, man, those are the ones that really, I was like, wow, like that. And sometimes it's not even a case that's bad or a really difficult case, but I say it's not difficult, but just the pressure from talking to the client. You don't know what's going on. You see the pet sick, you haven't done anything yet. And they come in telling you, man, if I lose this dog, I may not be here next week because I just lost my dad. I just lost my mom. You know, my kid just passed away. And then some of them come in that can't have kids, so they put that love into a pet. Granted, a pet's life is not as long as a human life. So they do everything they can to take care of them. Sadly, sometimes they may go to places that may be a little too busy, that's not paying much attention, don't do a good exam, may miss some things like that. And none of us are perfect. But it may be something I find that they've never heard of before, and the dog's 6, and, you know, had they known. So it's just stuff like that you get into. But yeah, there are some people, their pet literally is all they have.
Yeah.
Yeah, and then some of them will lose a parent, and they'll take the parent's pet to try to take care of it, and those are heavy cases.
Oh, yeah.
Like really heavy, because the people have anxiety. I can't treat their anxiety, but all I can do is treat the pet, right? But and some of them come in. I had one last week come in, and she struggles from anxiety, depression, etc. So not only am I trying to treat the pet, I have to be able to see when someone may be in a space where they're not their best selves. I have to learn how to communicate with them to get what I need, the information I need to be able to take care of the pet. So it's more than just doing an exam, prescribing a medication. I have to now, every room I go in is different. It's just, I never thought, you know, when I was going to vet school, I would have to almost be a mental health coach sometimes.
Absolutely.
Yeah.
Yeah.
Yeah, it's weird, but it works. I've gotten so good at it. I enjoy it. You know, I enjoy helping people calm down, relieve some of their stress, their anxiety about their pet. And some of them come in before I can even speak. They're concerned about the price. So I have to say, hey, irrespective of how much it costs, you deserve to know everything your pet needs and everything that's going on with your pet. Some places you walk into, if you tell them you already asking about money and you don't have much money to spend, they're limited on what they'll tell you. Correct. In regards to the physical exam and things like that. But I believe whether you have $10 or $100 million, you need to know what's going on with your pet. And that's how I treat every client. Yep.
Because you know, I tell people all the time, it's a journey. It's not a sprint. And because you're getting people that don't know nothing about taking care of pets to people who do a really good job. Yeah. So education is everything. Just like when I was telling you about your Instagram, I mean, that's why on my Instagram, I do so much education. Yeah. You don't have to be my patient, but it gives you the courage to stand up for yourself for these doctors that's not giving you the right care that you need.
And most people they're trusting the doctor. My mom trusts her doctor. My sister trusts her doctor. So when I go through their charts, I have questions that you need.
Same. I'm going through that right now, actually.
Yeah. And they ask them, and they're not getting correct or appropriate answers. So a lot of people go to the doctor for help, and they end up leaving or being misused, abused, manipulated, especially the elderly. You know. So I'm grateful that I have the medical knowledge to read through my family's chart.
Same.
And be able to ask questions and stuff like that.
Yeah, I'm actually going through that right now because I tell a lot of people, you know, it's good to have somebody in your family that knows medicine. Yeah. Because for one, medicine is different when you are Black. I don't care what nobody says. I worked in the ER. I have seen it with my own eyes. Yeah. They expect Black people to be able to take pain, right? Yeah. Like my mom recently is in the hospital. This is her second surgery. Yeah. The doctor missed something, developed scar tissue, back in the hospital, lost 30 pounds. Yeah. But I read her note. I was like, okay, so why did you take out her appendix? Yeah. Her small bowel has nothing to do with her appendix. Yeah. So what is an incidental appendectomy? Like, that's why I feel like, and you know, my family, none of them know medicine.
They don't know, yeah. So they can't even defend themselves.
Correct.
Yeah. So sometimes it's an insurance thing.
Yeah. Yeah. And it makes it harder too, you know, when you're seeing patients and you're trying to take care of your mom from afar. So it's, you know, it's crazy, but they do treat Black people differently.
In veterinary medicine as well. Yeah. To be honest with you, it's very difficult for kids to even get into veterinary medicine because you technically need to to go and shadow at a hospital. Well, most of the hospitals are owned by, you know, white individuals, or, you know, so they're very selective of who they'll let come in the door. So you get into high school and this kid is so passionate about wanting to pursue veterinary medicine, but they don't even have an avenue, which is why I open my practice up to anybody that want to come. I right now have 3 to 5 students. I've had preceptorships come. Like, that's why I open my doors, because I didn't have it's my old boss to this day. I thank her, and she's Puerto Rican. I was a large animal guy. I rodeoed. You know, I knew nothing about small animal, but I was a guy. I was strong. I could hold a dog that may have been too heavy for them. But she took a chance on me when she took me. But it was hard just getting in the door. It's just a shadow. Not even asking for a paying job, just a shadow. It's hard to find somewhere to go.
Even in my field, like, a lot of people want to do this, but they're not gonna like give you a door, because a lot of times they're like, no, we only want someone with experience.
Yeah.
How the hell they gonna get experience if you don't show them?
Exactly.
You
Yeah,
know,
that's the catch.
Exactly.
And see, that's what I feel like is a systematic way of Xing us off the list, because they know it's going to be difficult for us to even get in the door.
Yeah.
How did you even get into wellness?
So I got into wellness. I played college football, so I wanted to stay around sports. So I wanted to do orthopedic medicine.
Yeah.
I like watching the surgery, but I was like, yeah, I'm a people person.
Yeah.
I don't want to have you in anesthesia and do a surgery.
Yeah.
And then so when I shadowed the doctor outpatient, there were so many people addicted to opiates.
Really?
Yeah, I was like, I ain't doing this. All you're doing is writing opiates all day.
Yeah.
You have people like doctors, you know, very influential people, affluent people that didn't know they had an addictive gene.
Right.
So now you set that off by
from a surgery or something like that.
Yeah. I was like, I'm not in the business of that. I want to do something preventative. And I was ER ICU trained, but I'm like, well, the reason a lot of these people are here is what? They're not doing things preventatively.
Preventative, yeah.
So I'm that step before that happens. So I wanted to, so people come here because they want to get better. People in the ER are there a lot of times because they don't have the right access to care, or they're just non-compliant.
Right.
So that's the difference between doing that. I'm glad I got to experience that, trauma units, all that. But this right here is a change from Western medicine, using natural things that's not habit forming to get the same but better results than what we're accustomed to learning in school.
Yeah, that's cool. That's you know I never thought about that. Honestly, before I went to vet school, I didn't realize that human medicine and animal medicine is the exact same. To be honest, I feel like animals get treated much better than human.
Yeah.
Yeah, 100%.
Yeah. And then people don't even know that animals can also take peptides the same way humans do for the same ailments.
Yeah, it's so much and most of the medicines, the surgeries, the techniques are tested on animals first.
Exactly.
Yeah.
Yeah.
So it's that's why they call it one medicine. Because animal medicine, human medicine is crazy. I almost went back to school to be an OBGYN.
Have fun with that.
Yeah. I was like, that's crazy, but no. I love medicine that much.
Yeah. I have the thing about OBGYNs, I feel like a lot of them are, from the patients that I have seen, a lot of them are just, let me help you have your baby. It's not,
preventative.
Yes.
Yeah.
It's not, what is menopause gonna look like? You over here crazy, mean as hell, cussing people out for no reason, losing family and friends.
I know somebody like that. I'm gonna send them your way.
Yeah, at the verge of divorce.
Yeah,
but it's your hormones.
Yeah,
and they think and they're crazy.
Yeah,
but the doctor never told them what that looks like.
Yeah,
but you only tell them about birth control, which I do not like, because that also messes you up.
Yeah,
you give yourself a chemical.
Yes, and my I feel like. Hopefully my sister don't be mad at me for saying this, but I feel like it messed up her younger life. My sister was healthy, she was fine, got on birth control, and it just it just did something with her body. To her body, just did something complete. The weight gain, the side effects, all of that. Yeah, granted, you don't have a baby, but do you want to switch that for your health? I don't. I hated that, but that's the medicine in the U.S., I guess.
And I feel like it's on a verge, because like a lot of people are starting to be open to hearing these natural things,
Right,
you know, but it's more of the new generation doctors like you and me that are doing it. But
That's
the
the
old
same.
ones, they're set on no, you're going to do this,
Yeah.
you're going to do that,
Yeah.
and they're not changing it.
Yeah, because they followed the book, but the book is flawed.
Exactly.
Yeah, so I think us, the younger generation, like you said, need to be, trying to change the narrative.
Correct.
And I think for me, I knew I was doing a decent job at that because my clientele is a variety. I mean, Hispanic, white, black. Sometimes they don't even speak English, but we figure it out, and that's how you're doing. Now you ain't gonna make everybody happy. It's gonna be people that that's impossible to satisfy, but for the most part across the board, I'm shocked. I was like, wow, they really want me to do it. They don't want to go anywhere else. So yeah, it helps.
What?
You can scroll to part 7. Click on there.
Okay. I do want to answer this one question though.
Yeah, that's fine.
Okay.
Ready?
Yeah.
Oh, he's over there. Okay. That's good.
Ready? Okay.
And action.
So, why is preventative medicine so important for pets, and what does that look like? What is preventative medicine?
Preventative medicine in like cats and dogs is more or less like parasite control, like fleas, ticks, gastrointestinal parasites, and you can also catch. They're zoonotic, which means you can get parasites from your pet. Fleas is definitely they carry illnesses that's zoonotic as well. Vaccinations is number one. Parvovirus, very deadly to a dog and cats actually, but you can prevent it by vaccinations. It's not truly that expensive. The preventative medicine is not that expensive. Maybe when you get a kitten or a puppy, the first, I say 4 months, they need to see us at least once a month. But after that, we see them once or twice a year. So, and the visits aren't that expensive. Granted, they do need to be having dental cleanings. You should be brushing their teeth at home. And the biggest thing is keeping them on a heartworm, flea, and tick preventative. It takes one mosquito to bite a dog or even a cat, and it can give them heartworm disease, which means, they have worms living in their heart. And it's very expensive to treat. The average family cannot afford to treat it the correct way. And sometimes the worms cause damage that's irreparable before the dog can even get rid of them. So it's not, preventative medicine is it can be very inexpensive. They just clients need to understand what they need to do, which they don't get educated a lot of times because they go in and it's just moving so fast, and they may have said it, but they didn't catch it because they're moving so fast. So like you said, the biggest thing is education. But yeah, it's not expensive at all.
Okay.
Yeah.
And so, for you, what's next for your clinic? Where do you see it at in the next 5 to 10 years? Do you plan on having multiple locations, other states?
Yeah. So right now we're in expansion to get a bigger home location.
After 1 year?
Yeah. Well, it's been like 1.5, 2 years or so. But we're definitely out of space. So we're gonna open a bigger location, and then I'll probably branch out different locations in different states. The biggest thing is customer service for me. I am very particular about customer service. I want the client to know what they paid for. I want to know what to look out for, when they need to come back. So I don't want to grow too fast to the point to where the customer service tanks, but I definitely in 5 years I should have hopefully 3 or 4 hospitals.
Customer service is everything,
Yeah.
especially when you're a black business.
Yeah.
I be like, y'all make sure they do this Google review now.
Yes.
I want a certain number.
And you know what's crazy is people that don't look like me, when they come in, they're already on the fence about, oh, this is different. Because just like you've never seen a black vet, they haven't either. And they don't look like me. So the trust factor, you can sense it when you walk in the room. But when they leave, I've changed their complete thought process about like, wow, I never knew my dog had this, and I can do this to fix it. No one ever told me that. So they actually become more trusting to someone who looks like me.
But what I don't understand is we had to take the same national certification board as our white counterparts. Why does that even matter? It's about the care that they're about to get, not because you've never seen a black vet before.
Colorism.
A vet is a vet, ma'am, sir.
It's colorism. I'm telling you.
It's crazy to me.
Yeah.
You shook because you see a black vet? Like,
some of them don't care about the degree. I got my Tuskegee degree, TU, in my lobby as a fashion statement. This is where I went and got my degree, which is a HBCU, and some people walk in and they see it. People like me know Tuskegee, but a lot of them ask you, where do you go to school? Because, of course, Georgia, Auburn, I went to Tuskegee. Like, that's where I went. And it's a different feeling.
Yes.
It's a completely different feeling. So I also feel like I'm able to introduce Tuskegee to them with the care that I actually provide for their pet. Because some of them only want to go to certain doctors that went to a certain school. It's crazy.
I had to explain that to someone the other day. I was like, guess what? You paid $120,000 to go to Emory.
Yeah.
Guess what? We got the same book.
The same thing.
Guess who got a job first?
Exactly.
A year later, you got your job.
Yeah.
Okay.
That's what happens.
Okay.
But it's, I don't know why people are like that in 2025, but it's
always about being better.
It still exists.
Yeah.
It still exists.
Well, I can say my student loans are less than yours.
Right.
And I got a job before you. Yeah.
Right. Well, we're not going to speak on student loans because
I know they're crazy.
they're crazy. But, honestly, had it not been for student loans, I honestly wouldn't have been able to go to school.
Absolutely.
Yeah. So
Me either.
it's just another bill I got to pay.
I'm going to need for Trump to do something about that, though.
Hopefully soon.
Can you give me half?
Hopefully
off,
soon.
please?
Yeah, because it's a little out of hand.
Yeah.
Yeah. And it's not getting any better.
And it's crazy when you go to these other countries and they get it for free.
Healthcare is free. I think in Canada, healthcare is free.
Yeah. But you have to pay for things like the dentist.
Yeah.
That's why you go over there. Some of them people, their grills be a little suspect. But I mean, other care is fine. But
What?
yeah, dentist is expensive over there.
What?
Yeah. So people let their teeth go lacking.
Man, no.
Yeah.
I can't do that.
I have to get a loan for my teeth now. Your things got to be white.
I can't do that.
Yeah.
I didn't know that.
Yeah.
I thought all healthcare was free over there.
I thought so too, but I just learned that dentists,
And dentistry is expensive.
Yes. Just for a simple cleaning.
Yeah. Oh, dogs too.
Oh, really?
In the thousands.
Really?
Yes. If they need extractions, a regular dental cleaning, you can get that under $1,000. But a dental cleaning can be $2,000 to $3,000 depending on where you go and what needs to be done. Yeah.
Oh, dogs are expensive. Moral of the story.
Yep.
Hey, if you get a pet now, make sure you have a security fund or something for them because it's expensive.
Yeah.
So what was your favorite animal to treat?
I love cattle. I could work with a cow all day long. I used to artificially inseminate them, which, I would get them pregnant without a bull. And then you get to go and palpate, feel the baby. And then you get to see the calf born. You can bottle feed it. I loved working with cattle. But now I don't think I have a favorite. I think I'm a country boy at heart. So it'll always be cows. Always be cows. Yeah.
Okay. And so now that you in this health phase, what's your favorite snack?
Ooh, I'm a Louisiana man, so we eat, right? But what's crazy is I've had to change my entire lifestyle
Yeah.
in order to maintain my health, right? And health is wealth.
Yes.
So my favorite snack, I would say, favorite snack. Jerky. Beef jerky.
Okay. Is it regular, teriyaki?
Original.
Yeah. Okay. What's your favorite, since you've been in Atlanta, what's your favorite meal or restaurant?
Ooh, I love Asian food, Asian cuisine. Pho.
Okay.
That's the noodle.
Yeah.
I can eat it every day.
Do you like sushi?
I love sushi,
Gotta take
but
you
it
to
ain't
this
got
place.
nothing. It has nothing on pho.
Pho is bomb.
It has nothing. You can keep the sushi. Just I'll get the soup.
Yeah.
Yeah, but well, you say you got to take me to a place. I'm down. I'm down.
I went yesterday. Ate them at a house and a home.
Well,
Mm-hmm.
you know my metabolism a little bit different than yours,
Yeah.
so I just can't eat too much rice.
I'm the same. This place actually wraps them in cucumber if you request it.
Oh.
So I ate like 6 rolls all wrapped in cucumber.
Okay, I can.
So
do
I went
that.
in.
I can do that.
Yeah.
Yeah,
Mhm.
yeah. We
I
gotta
got
go
you.
there.
I got you. And then, so what is one word to describe your journey so far?
One word to
Gotta be quick.
describe
Come on, let's get it.
Impossible.
There it is.
Yeah, it's impossible.
Yeah.
Yeah.
You made the impossible possible.
Yeah.
So y'all hear that?
Yeah.
You can do anything you set your mind to. I don't care what your background is. Growing up poor, guys, I grew up poor too.
Yeah.
But you don't have to be an object or a community. Don't use that as an excuse.
No.
You know, you get to choose your hard.
Yeah.
Okay. You can grow up and be a doctor. You can grow up and be a lawyer. Take those steps to do that. That's why we're interviewing people like him who came from nothing to be somebody. I'm the same thing. All right.
And I didn't know I was poor.
Yeah.
When I was in it, I didn't know.
Yeah.
Yeah.
The hustle for us is different.
Yeah.
If you want this, you have to hustle.
Yeah. It's easy.
Yeah.
If you submerge yourself in it.
And so what would you tell your 16-year-old self from what you've experienced so far in order to be you without the mistakes?
To just learn how to protect yourself, because I can give and love and, you know, work so hard and not take care of myself. So protect myself, take care of myself, you know, continue to work hard, but make sure you enjoy yourself a little bit more along the way, because I was so focused. I didn't want to do anything outside of achieving the goal, which I kind of regret that. You know, I wish I would have had a little bit more fun, etc. I mean, I wasn't a square. I mean, I enjoyed, but like after I graduated vet school, I was so focused to where I didn't commingle much. I didn't go out much. I didn't do much. I went to work. I went home. I went to sleep when I could, and that's all I did, which wasn't healthy.
Yeah. And it's like that when you first start out, you know, because you're establishing yourself. I was the same way.
Yeah.
So I always tell people, you know, now I have everything on the calendar.
Yeah.
Time, everything. So I have time for myself penciled
You
in.
scheduled it.
Yeah.
Yeah. And then my 16-year-old self, I just think at that time I was just, man, I was like, I got to get to vet school. That's what I was. But I think I did a good job. I think I did a decent job.
Then what advice would you give someone who wants to be you?
They'll never be me. They can't be me, but they can get close.
Exactly.
But yeah, you have to make a step every single day you wake up, whether that's reading a book, or something in order to get closer to that goal.
Yeah.
But if you keep talking, saying you want to do this, you want to do that, but you don't ever make a step, nothing's ever going to come of that, you know. But you have to make a step every day.
Yep.
You know, and you have to separate yourself. You have friends that may not be as dedicated to achieving a goal, and that means you may not be able to go out one night with them, you know. So you have to be able to decipher, you know, what you need to do compared to, you know, other people.
Yeah.
So, yeah.
Tough decisions got to be made when you are building
Sacrifice.
the business. Yeah.
Yeah.
And your friends might not be getting it, but you are adulting and they're not.
Yeah.
Sometimes
and some people never grow up.
That part.
They never grow up.
Yeah.
You know, my friends look at me now and they're like, wow, you know, you really did that. I'm like, did you think I was joking? I don't know, you know, if I told you I was going to vet school, I'm going to vet school. But they can say stuff and they never, you know, they just talking, you know. Yeah.
Yep. So for people that want to follow your work, book an appointment, how is that set up?
Go to our website, Soft Paws. That's SoftPaws. A is in apple, C is in cat. SoftPawsAC.com, and just schedule an appointment. You can request an appointment online, see the times, and it's easy. I work hard to make sure we have availability, so you're not waiting weeks to be seen. We stay open pretty late, so if you have urgent care, emergency, you know, we're typically there up until 8, 9 o'clock at night. So I'm easy to find.
And you take insurance as well?
So how insurance work in animal medicine is most of them make you pay up front and then you file a claim to be reimbursed, but you never know what they're gonna reimburse you. There are some that do upfront payments. They'll pay us directly and the client just pay the difference. But we do accept insurance. We work with insurance. Yeah.
Okay.
And if they don't have the funds for insurance, if they only have, less than $100, it's a lot you can do with less than $100. So you don't have to be rich to be able to take care of your pet.
Okay.
Yeah.
And what is your Instagram handle?
My personal Instagram.
The one for your business.
Actually, we just switched it to Soft Paws Animal Clinic.
But I want them to follow your personal too, because both of them are kind of together, and people can learn a lot about animals through your Instagram.
My personal is Vetology, the study of veterinary medicine. VETOLOGY 18, and that's on Instagram. On Facebook, it's just my name, Antonio Jackson.
Okay. So guys, I know it's shocking to see a Black veterinarian, but it's also really, really cool. So if you don't know anything about animals, how to take care of your animal, he's here in Atlanta.
Yeah.
Take a trip. I promise you'll be the best experience ever. You see, he literally cares about what he's doing. He's passionate about what he does. This is who you want taking care of your animals, and I'm here to take care of you.
Yeah. And two, if you don't have a pet and you're looking to get a pet and you just want to brainstorm about which pet, which breeds would be best for you, how much things will cost so you can budget for it, I encourage you to book a consultation as well.
And you don't hear that from a lot of people either.
Yeah.
Because I know I'm going to need that.
Yeah.
All right. So guys, we're thankful that you were here to watch us with Dr. Jackson here. Keep following Gentle Giant Care, the Q Effect, for more great people, great actors. We're just here to motivate, right? To show you who you can be by following their footsteps. All right. So see you next time.